Hi, future doctors. I am Dr. Salam Hamdi, anesthesiologist intensivist at Sahlul Academic Hospital, associate professor in anesthesiology and intensive care, affiliated to the Faculty of Medicine of SUS. In today's educational medical short video, I will teach you about something that every medical student should know. It is about prothrombin time and INR interpretation. Consider this clinical scenario where we take the same blood sample and we send it to a laboratory A and laboratory B. The prothrombin time from laboratory A came 18 seconds, but the prothrombin time for the same blood, as I mentioned, came from laboratory B with the result of 22 seconds. Immediately, doubt arises. Is one of the labs wrong? Then you check the international normalized ratio, and it is identical in both reports. So, what it is happening? To respond to this question, we have first to know what it is prothrombin time and what it is INR. Both tests evaluate the same thing, meaning the extrinsic and the common pathway of the coagulation. Prothrombin time measured in seconds is not an absolute value. It depends heavily on the thromboplastin reagent used by the laboratory. Each reagent has a different sensitivity to reductions in clotting factors, particularly in patients receiving warfarin. This sensitivity is expressed as the International Sensitivity Index, ISI. Because the International Sensitivity Index is variable according to the reagent used to measure the prothrombin time, prothrombin time in seconds can differ between two laboratories, between two reagent brands, and even between two reagent patches in the same laboratory. This is exactly why the international normalized ratio was developed. In fact, it is a calculated test derived from the prothrombin time test. As I mentioned indirectly, the INR mathematically corrects for the reagent variability using the International Sensitivity Index, as you can see in this equation. INR is a derived value calculated from prothrombin time using the International Sensitivity Index, which is variable according to the reagent used in the laboratory. So while prothrombin time in seconds may vary, the INR standardizes the result, allowing meaningful comparison across labs. If prothrombin time differs, but INR is the same, this is not a lab error. It is proper standardization. In conclusion, the key messages: first, in patients on vitamin K antagonists, interpret international normalized ratio, not prothrombin time. Second, understand how a test is generated before judging its reliability. Third, variability does not always mean inaccuracy. Thank you and goodbye, and meet you in future videos.